Hello, everyone. Welcome to this QuEST workshop on cognitive interviewing. My name is Todd Lewis. I'm a fourth-year PhD candidate at the Harvard T.H. Chan School of Public Health, and I'm excited to share a little bit about cognitive interviews broadly and how we'll be using them with the People's Voice Survey. So this presentation will last for about 20 to 30 minutes, and we'll take you through some of the fundamentals. So our agenda for this presentation is to very quickly just discuss a few common survey problems. I will introduce the fundamentals of cognitive interviewing. I will talk you through a bit about best practices for conducting cognitive interviews and briefly touch on what analysis might look like for cognitive interview data. And then we can discuss a few practical considerations for cognitive interviews. So first, many researchers use surveys in their work, and many of us are experts in survey design or have created a survey at some point. But I think a question that we all have to take a step back to examine is how sure are we in what we are measuring? And that's really why validation is so important as part of the survey design and process. And so we need to ask questions like, do participants understand the questions in our survey? Are participants able to answer these questions? Do they have the information that they need to answer? And are they willing to answer the questions? Are they comfortable answering potentially sensitive questions? So these are the sorts of things that we do think about and should be thinking about when we construct a survey. So this is just one of many examples of things that can go wrong in surveys, or maybe not necessarily wrong, but just indicate that the data that we're collecting is not always what we think we're collecting. So this example is one of acquiescence bias, which is a response bias in which respondents are more likely to pick a positive response to the question. So this is a sort of an old example. It's from the Pew Research Center in the US. And Pew asked this question about military strength and diplomacy in two ways. So if you look in the blue example box, they asked in an agree-disagree format. The best way to ensure peace is through military strength, agree or disagree. And 55% of people agreed, while 42% disagreed. When they asked in a forced choice format, where they gave two different options, instead of just giving the first option on military strength, they offered another option on diplomacy, and they found that only 33% of people agreed with the best way to ensure peace is through military strength, while 55% agreed with diplomacy is the best way to ensure peace in this forced choice format. So I just show this to illustrate that how we ask questions, the words we use, the order in which we ask questions, the response options, all of these elements to formulating a question in a survey are complex and will influence meaningfully how people respond to surveys and the data that we get. So because questions are often flawed, or even when they're not flawed, they may not be getting at exactly what we as the researchers think they're getting at, it's important to be really intentional in our survey design. So we need to be on the lookout for questions that are too vague. We need to make sure they're crystal clear to the respondent. We need to look out for questions that maybe are too complex or abstract, and that might make it more difficult for the respondent to answer the question or interpret it as we expect. Questions that are difficult to interpret or easy to misinterpret. So the respondent thinks they're answering a certain way, or we think they're answering a certain way, and perhaps they're answering, our conceptions of their answer are different. Or questions that are reliant on specific knowledge or context that perhaps the respondent doesn't have. So if we take a very simple example, a question similar to ones we're asking in the People's Voice Survey, we can diagnose some issues with it. So the example is, have you visited your doctor in the last month? So it seems straightforward, and it is, it's a simple question, but you might look at this and say, well, I did visit the doctor, but it was to bring a child or a dependent to care. Does that count? Or you might say, well, I visited the doctor, but it was really a telehealth visit. Or maybe you saw a practice nurse instead of the doctor at your primary care office. So these are the kinds of confusions that even a very simple question can introduce. And that's why cognitive interviewing can be so helpful, because you can sort of investigate and diagnose some of these problems. And of course, we'll talk more about that. So cognitive interviewing, sometimes called cognitive testing, is an evidence-based qualitative method designed to investigate whether a survey question or a survey fulfills its intended purpose. So again, are we measuring what we think we're measuring? In cognitive interviewing, individuals are presented with a survey more or less as it would be delivered in the study when you're fielding it for data collection, with additional questions, prompts, and opportunities for feedback integrated into the instrument. It's typically conducted by a trained individual with recruited survey takers in more or less a laboratory setting. It's usually done in a pre-testing phase. So you will sort of often do a convenient sample of individuals who are available to you to pre-test the survey with. And they are usually recorded for subsequent analysis, and we'll talk a bit more about that. They tend to be long in duration. The sort of loose rule of thumb is an hour cognitive interview for 15 to 20 questions, but it really depends on the length and complexity of your survey, on the style of cognitive interview that you're conducting. All of these factors determine how long these are. So it's hard to sort of pin down a specific number. And typically cognitive interviews are few in number, maybe around 10, sometimes less, sometimes more. And we'll talk a bit more later on about how you sort of navigate the sample size for something like this. So cognitive interviewing, as I've said, really aims to improve the survey by answering a number of questions, such as, are the questions understood consistently? So if we take the same question and ask multiple different people who might be in our ultimate target population, do they all understand the question roughly in the same way? Do respondents have the information they need to answer the questions? For example, on did you visit the doctor in the last month, or how many times did you visit the doctor in the last month? Are we telling them what we think of as doctor? What does that mean? Are we telling them what we think of as a visit? What does that mean? We might want to know, how do respondents formulate their response? What's the thought process they go through to arrive at their answer? And that can help us formulate our questions better. We can understand if response options describe what respondents have to say. If we ask about a health facility that they visit, for example, we maybe are asking about primary care, and they may get their primary care at a hospital, and they may want to respond with hospital. But we're thinking more of general practitioners, or of nurse practitioners, or local clinics where primary care may be more frequently accessed. So we want to understand if the response options actually reflect how the respondents naturally answer. Have we considered social and cultural context, the way people understand their health system, the way they understand their own health, and how this influences the way that they respond to survey questions? Cognitive interviews can help us understand if survey instructions themselves are clear. Do respondents understand what we want them to do with the survey? And it can help us understand if they're willing to answer all questions, especially if questions that are sensitive, including those about an individual's health. So there's a lot of opportunity here for cognitive interviews to sort of illuminate problems along these multiple dimensions. So something that is useful for helping us understand and develop our cognitive interviews is to think a bit about the actual cognitive process involved in answering a survey question. So this is a 4-part framework of question response that really grew out of experimental psychology. So the first element that anyone goes through when they're answering any kind of question is comprehension. So does the respondent understand the question? That is sort of the baseline. The second piece of this is retrieval. Can the respondent actually call up, remember, access the information they need to answer the question? Can they actually remember the number of visits they made to a doctor in the last year? Can they remember the different reasons that they visited that doctor, the different medical needs they had? The third part of that is judgment or estimation. So this is more about how respondents actually form their answer. What's the thought process they use to arrive at the answer and decide on the appropriate answer based on the information that they retrieved and their understanding of the question? This is also useful for understanding how respondents bound a question. What's the time frame they have in mind when we ask the question? Who are the providers that they're thinking of when we ask a question? And then the last piece is actually selecting a response. So the respondent may decide on their answer and they have something in mind, but that's not where the answering process ends. they need to map that response to one of the options that we're offering them in the survey. So this is really useful for understanding whether our response options are comprehensive and clear and map to what the respondents want to say. So there are two primary modes of cognitive interviewing, or two techniques really. One is think aloud interviewing. In think aloud interviewing, respondents are asked a question and instructed to verbalize their thoughts as they come up with their answer. So you will ask the survey question, they will respond, and then you give them a chance to walk you through how they arrived at their response, or they may do that in real time as they're responding the first time. We'll talk more about think aloud interviewing in a moment. The second technique is verbal probing, or sometimes called respondent debriefing. With verbal probing, which is the term that I'll use throughout the rest of the presentation, respondents are asked a question followed by a series of follow-up questions, or what we call probe questions, to elicit their understanding of the question or how they arrived at their answer. And so this allows you to ask very targeted questions after each survey item or at the end of the survey. And often these are used in combination. So let me talk you through these two techniques in a bit more detail. So with think aloud interviewing, we typically ask the respondent to give us a free form answer. So you would ask them to tell you what is going through their mind. You ask them the survey question, let them talk you through it as they arrive at their answer. And can be very, very helpful in understanding how they understand the question and how they arrive at their answer. So some common prompts you might use as the interviewer conducting the cognitive interview are things like, when you answer the questions, I would like you to tell me what you're thinking. Or please say out loud anything that comes into your mind while you're answering the question. Or please tell me what's going through your mind as you work out the answer. So this can be a bit awkward, a bit difficult for people to do. It's not necessarily a natural way to answer a question. So there's a couple of things that you can do to help ease this. One is to begin with a simple warm-up question. A really popular one is how many windows are in the room you're in right now. You can even do the example first and describe, I'm in my family room and there are 2 windows in front of me and 1 to my left, so I would say 3 windows. Or you might ask them how many rooms are in their house, different sort of simple questions that help them understand a think aloud approach. And another key is to sort of praise the respondent as they're doing the think aloud, because again, this can be awkward and unnatural for people to do. So there are advantages to disadvantages to the think aloud approach. One advantage is that it doesn't require a lot of training on the part of the interviewer, except for excellent listening skills and kindness in your receipt of all the information. And also it can help avoid interviewer-induced bias, or sometimes called artifact findings, which is when the very act of talking through the survey question changes how the respondent answers. But if we use the think aloud approach and we're not constantly prompting the interviewee, then we're less likely to bias them. But it's still possible that they may change how they think about a question just through the think aloud approach. Some disadvantages is that, as I mentioned, it can be really burdensome to subjects. Some people don't respond well to this sort of technique. Subjects may sort of meander off topic if they're not super directed in the cognitive interview. They may focus more on the process of thinking aloud rather than on how they actually answer the question. And like I said, it could change the process of responding just through the verbalization. It can also be sort of time consuming, especially if people aren't very directed in their think aloud responses, because you can get a lot of data from this. And it may not always be super targeted or helpful in thinking through how you maybe need to change your survey. So if we look at the other technique that I mentioned earlier, verbal probing, there are a couple of different elements of verbal probing that I want to take you through. So 2 approaches to verbal probing are proactive and reactive probes. So proactive or scripted verbal probes are verbal probes that are fashioned in advance of the cognitive interview in order to search for potential problems. So based on subject matter expertise, your own knowledge of the survey and where you may anticipate there are problems, you can, in advance of the interview, develop these scripted probes that target certain issues in the survey where you think there might be a problem. With reactive or spontaneous verbal probes, these are verbal probes that are developed in a sort of ad hoc or non-standardized way during the cognitive interview. And these are often in response to a respondent's behavior. So if you ask a question, can you tell me the number of visits you made to your physician in the last month? If they hesitate or they're struggling with answering, you might take that as an opportunity to probe on that. So, tell me how you're thinking about this question, or how do you remember the number of visits that you made? And so you're coming up with the probes on the spot in response to the interviewee and their behavior. Uh, and so these kinds of probes are often combined in a sort of a semi-structured approach, sort of similar to a semi-structured interview that you might have used or be familiar with in qualitative research, where you have some proactive or scripted probes that you use, but you also have some reactive probes that you allow or prepare for even in advance, just so that you can respond in real time, depending on how the respondent takes the survey. So there are really two types of proactive probes. These are our scripted probes. There are respondent-driven probes. These are general probes that aim to gather participants' initial reactions to a question. So sort of similar to Think Aloud. So these would just be open-ended questions about the question answering process. How did you find answering this question? Very simple, open-ended, and if the Think Aloud process is difficult for the participant, this is a great alternative to give them the floor, give them a chance to say anything they want about answering the question without sort of driving them too much. There are also theory-driven probes, and these investigate specific problems, as I mentioned earlier, that might have occurred based on your pre-existing knowledge about what you're trying to glean from that survey. So if I ask a question about health facilities that you've used in the last 2 years, I might say, well, what does the term health facility, what does that mean to you? Knowing that health facility can mean many different things to many different people at all levels of the health system. So I might plan to use this probe in advance. And so this artifact findings issue comes up again with theory-driven probes, when respondents might think differently about a question, or they might answer differently simply because I've asked a very targeted probe question. If I didn't ask about health facility, they maybe wouldn't have thought about it and they would have made an assumption. And by asking about health facility, they may actually change their answer or be more thoughtful or critical about what their answer is. And so we need to just be aware of that as the researcher, because the probe questions won't be there when the survey is actually delivered during data collection. So I just wanted to give you some examples of proactive probes or scripted probes that are commonly used. I've tailored these all to health system research on some level, but you can really tailor them to the needs of your survey. And so please, feel free to come back to this as a resource, or jot these down. And I've organized them by the 4 components to answering a question. So when we think about comprehension, we might want to know, well, what did you understand by the term medical attention when answering this question? This is a phrase we're using in the People's Voice survey, and it's a valid one. People might understand the term medical attention differently. Or what does the term specialist mean to you? Because that varies between people, between populations, between countries. When we think about retrieval, calling up information you need to answer a question, we might ask, well, how easy or difficult was it to remember whether or not you visited a health facility in the last 12 months? We might want to know what triggers people have that help them remember. Was it a long drive? Was it a long walk? How do you remember that occasion of going to the health facility? Or we might ask, well, what time period were you thinking about when answering? How sure are you about the number of visits you made? These are all ways to understand how people recall the information they need for a question. When we think about judgment, we might ask, well, how did you work out your answer to this question? We ask a few rating questions in the People's Voice survey. So we might want to know, well, how did you arrive at that rating? You said you would rate respect in your physician's office at a 6. Well, tell me why a 6. You might ask, how did you understand the term usually? What did that mean to them when they think about how they bounded the answer to their question? And for response, we might want to know, well, why did you choose that particular answer rather than one of the other answers from the response list? Or are there categories missing from the response options? Was there something that you wanted to answer that wasn't an option for you to select? And then finally, some just general probes, like I mentioned earlier. How did you arrive at that answer? Or in response to a respondent's behavior, you might say, I noticed that you hesitated. Please tell me what you were thinking. So these are all different sort of example probes and just a starting point really for what you might ask in a cognitive interview. So in thinking about probing, there's really two times when you can probe. So there's concurrent probing, which is probing that occurs after each individual question has been answered. So you read the survey question, you get an answer, and then you immediately follow up with probe questions. In retrospective probing, the probing occurs after the respondent has answered the entire survey. So you deliver the entire survey as you would during actual data collection. And then at the end, you go back and then you can probe on specific questions or things you observed, issues that you thought the respondent had when answering the survey. So there's many things to consider when you're picking one of these approaches. Survey structure is something to think about. If you have a really long survey, you might want to use concurrent probing because it's hard to remember what happened at the beginning of the survey by the time you get to the end. Or if you have subsections, you might want to probe at the end of subsections to sort of break it up a little bit, but still maintain survey flow. You might want to think about question similarity. If you have a set of questions that are all very similar or have very similar response options, maybe you want to probe at the end of that list of similar questions. And you also want to be thoughtful about the survey mode. For example, for a self-administered survey, it's very hard for the interviewer to know when the interviewee is ready to move on to the next question and you should probe. So typically for a self-administered survey, we would let the respondent take the survey in its entirety and then probe at the end and do a form of retrospective probing. So there's lots of considerations, but these are just two ways that you might integrate probe questions into your cognitive interview process, depending on the goals of your testing. And so just in sum, when you think about writing probes, which is really crucial, writing good probes is crucial for having an effective cognitive interview. You want good probes to be neutral or balanced. You don't want to say, was that question easy? But you might want to say, well, how was that question for you? Or was that question easy or hard for you to answer? Ideally, your questions would be open-ended to generate dialogue or even monologue with your respondent so you can really get into their head and understand what they're thinking. You want them to be simple. Cognitive interviews can be a cognitively intense process. So you want simple probe questions that just prompt a conversation. And you want to make sure that your probes reflect all of the goals of your testing. You want to think in advance, why are we doing these cognitive interviews? What do we think the potential problems are with the survey? And how can we use these probe questions to investigate those? And in contrast, bad probes would be leading or closed-ended questions, complicated or double-barreled probe questions, or questions that really don't align well with the goals of the cognitive interviewing and the validation process for your survey. So verbal probes, just like the talk aloud approach, there are advantages and disadvantages. So the advantages are that you can often get more information from fewer interviews. And this is because you can be very efficient and targeted. Because you can isolate certain survey questions or sections of your survey where you're going to need to probe and get more information. And because probing is more directive than think aloud, you're more likely, typically, to get information that you need that really helps you understand where your survey may need to be altered. Verbal probing also tends to be more acceptable to respondents. It's easier to answer follow-up questions for many people than it is to do the think aloud. And it can be easier to analyze because you've already organized the feedback by question. But I will say that verbal probe can be easily combined with think aloud, and the approaches can work beautifully in concert. There are also disadvantages to verbal probe, of course. It often requires more interviewer training and a bit of skill to be able to juggle administering the survey and then also navigating probes in real time, especially if you're using a combination approach of think aloud and verbal probe. If you're using scripted probes and spontaneous probes, that takes a bit more practice to do effectively. And of course, you may also bias the responses from your interviewers, these sort of reactivity effects, just by asking probe questions throughout the survey. So now that we've talked about a few techniques, I just want to talk about the actual process of conducting a cognitive interview. So these are somewhat similar to a semi-structured or in-depth interview that are common in qualitative research. You might select an interview technique or mode appropriate for the survey. As I've said, there's a lot of different ways you can run an effective cognitive interview, so you'll want to be thoughtful about that. Again, self-administered surveys may be better with retrospective probing, or for an interviewer-administered survey, you might prefer concurrent probing. You might also want to think about how you want to deliver this cognitive interview, how you want to conduct it in terms of in person, which is often the most effective mode for an interview, an in-depth interview of this nature. You might also think about how you would do it over the phone or over the video call, just depending on the goals of the cognitive interview. You really want to be on the lookout during the interview for areas of confusion, for contradictions, ambiguity in the survey or where the respondent identifies ambiguity, or any reluctance from the respondent as well. If they are hesitating to answer the question or maybe don't want to answer the question. Typically, we would have recorded the interview, as I mentioned earlier. It can be very difficult to juggle administering the survey and also capturing all the feedback from the respondent. So we highly recommend recording the interview so you can go back and listen to it later and make sure you capture everything the respondent said. I also highly recommend taking notes during or after the interview to capture any issues or questions that you've identified. I like to memo immediately after my cognitive interviews and take down everything that I can remember and the big issues that I identified in the interview as well, and help sort of solidify what I've learned from the interview in the immediate after the interview. Just a quick overview of analysis. Typically, what you do is aggregate comments you receive from each respondent for each survey item across all of your respondents. So your data might be something like, subject wasn't sure if optometrist or dentist counted as a healthcare provider. So that might be something that multiple respondents identified as a problem with the question, have you visited a healthcare provider? So we might identify that and analyze that as our data. The analysis really aims to identify common themes or common problems. And uniquely to cognitive interviews, I think you're really looking for departures from what you as the researcher expect. You really want to see areas where what you thought would happen isn't what happened, or the way you thought people would understand the survey isn't how they understood it. So you're looking for comprehension, adequacy of the response. If the respondent asked for you to reformulate the question or asked for you to read it again, that might be a sign that they didn't understand or it was too complex to give verbally, for example. You might look at how they interpret the question. And of course, you might jot down comments or voluntary observations if the person said, I just want to say this question was really hard for me to answer. If the respondent is using don't know a lot as a response, that can be telling about your survey. Or if they're not able to answer, or the response latency, if it's taking them a really long time to answer the question. So these are the kinds of things that you want to keep an eye out for in your analysis and in your data. So actual analysis of cognitive interviews, it can be formal or informal. A formal analysis might involve a more intensive thematic content analysis, some form of qualitative coding. Often cognitive interviews are done more informally, and there's informal analysis where you just aggregate interviewer notes and you synthesize across those notes to see just the key themes, the really big ticket items or issues that are emerging from the interviews. And then you take your results from the analysis and then you adapt the survey based on that feedback. And you may then follow that with additional cognitive interviews, or you may move on to a pre-testing or piloting phase, depending on how confident you are that your survey is achieving your research goals. A few practical considerations for us to discuss. So I mentioned earlier the sample size for this. You're not aiming for statistical representation. Usually, your cognitive interviewees are a convenient sample, sometimes a maximum variation sample, where you want a wide range of participants from hopefully or helpfully from your ultimate target population, because you really want to understand how different kinds of people will interpret your survey and how they will answer it. So having a wide swath of people is always very helpful. You want to do enough interviews that you can understand major issues with your survey, though they're often cognitive interviews are done with small groups of people, though you want to just be aware that the fewer you do, the more likely it is that you'll get very niche results that may not generalize to other people that you will ultimately field your survey with. I've seen papers that describe as few as 5 cognitive interviews and as many as 30 or more cognitive interviews. So it really depends on the complexity of your survey, the goals of your cognitive interviewing and validating process, and other factors. So there's really no one size fits all answer for the sample size. Cognitive interviews are often done iteratively. So you might do a round of cognitive interviews, adapt your survey, test it again with different people, and then you might adapt your survey again, just depending on how much feedback and how many problems you're identifying, and really the extent of the changes that you're making in each round. But it's not uncommon to do cognitive interviews rounds multiple times. You might do cognitive interviews before data collection, as we'll be doing the People's Voice survey as a form of pre-testing to make sure you're rolling out the best survey you can produce. But you might also do it after data collection as a form of quality assurance of the data that you've collected. And then in terms of reporting, cognitive interviewing studies exist, standalone studies where people report their process and their findings from cognitive interviews. For other studies where it's more part of the validation process, it's sort of a method step to the study, then you would typically report cognitive interviews in the method section of the paper. So I included some sources here that I used to inform this presentation. I highly recommend you pause here and investigate these sources. If you would like more information, just to learn more about cognitive interviews, there are some really fantastic resources here.